What's up, my miners of intelligence and consciousness? I'm Rick Brooks, and this is Rick's Mind. Today with me, I have guest Dr. Stephen Deeks, who is a medical doctor and an HIV researcher at the University of California, San Francisco. Welcome to the show.
Thank you. Great to be here.
Thanks for agreeing to doing this. I think I'll always like to start my interviews off, because I'm very curious how you ended up in the worlds of HIV research. So if you can kind of give us a quick background on how you got into this field of research, that'd be great.
Sure. Yeah. So I did my training to become a medical doctor in San Francisco between 1990 and 1993. And that was about as bad as it ever got in terms of HIV. Half of the hospital, 50% of people in our hospital during those years had HIV. So it was something you could not avoid. And to be honest, I didn't enjoy the work in the hospital because people were sick and dying. I tried to do my best, but I also had a clinic in which I was taking care of these very young, healthy, highly engaged gay men who had this disease, but who were fighting the system. And I found that they were my age, and I just bonded with them, and I chose to have a career in the outpatient setting. Make sense?
Yes, it does. Yeah, you mean, you're definitely looking at someone that's your age. You kind of see yourself, right, in them, and it pulled at your heartstrings, and that's how you ended up getting in that line of research.
No. So this is the early 90s, right? This is before we had treatment. So, and people, if they get HIV, they're usually pretty healthy for several years. So I had this group of basically my peers, who had organized in San Francisco and elsewhere into these activist groups, these community groups, and they were fighting the fight. By this point in time, they actually had started collaborating with Tony Fauci, now famous for COVID. But at the time, he was very famous because he was the first person, really, I think, in science to reach out to community people. So you had Tony Fauci at NIH, you had these community advocates, and we had a very powerful Department of Public Health. And it was a magical time because we all came together, and I almost became an AIDS activist myself. And we formed these collaborations, and we did great things. Because it was from that point forward that we began to develop these treatments that basically has turned this into a very manageable disease.
Yeah, and so one of the things I kind of wanted to ask, right, is this is an interesting period of history. So because this disease was in primarily the predominantly gay community, and I think a lot of minority communities, how hard was it to begin to get funding and to get the public to care about that in the early days? Was it an uphill battle? Or because I wasn't really, I was alive, but I was a baby at this time. So what do you remember about that?
Well, so there was different waves. The first wave was essentially in the United States. The first wave was all gay men, and it was everybody, right? Because it was, no one knew about HIV. So in my clinic, I had CEOs of major companies. I had a guy from Apple, a major player at Apple, and then and I had the entire spectrum, because it affected everybody. But very quickly, those people who had resources and healthcare, they were no longer getting HIV. So by the mid and 1990s, the epidemic shifted toward, the communities that were not as engaged to healthcare, and primarily people of color, primarily women. And so the entire epidemic changed from the early 90s to the late 90s. We're sort of seeing this with COVID now, the same kind of situation. People with means know how to protect themselves. People who are a bit marginalized do not.